Hello, good morning. Dr. Nigel here from Premier Clinic. Yeah, so today we'd like to share with you regarding some slimming program that we have here in Premier Clinic. So I have explained previously regarding cool sculpting, those treatment that will reduce your fat cell number. So today we'd like to discuss more regarding a treatment that can help to reduce the fat cell volume. So to refresh again, yeah, our fat cell number may be constant when we reach our puberty, 18 years old. So when you gain weight, that means you passive, you eat too much, your energy will be stored in this fat cell. So when a lot of fat cell bulging together, that you started to see your bulges. Yeah, so when you are on diet, you have strong mindset, you go for exercise. Yeah, so all this energy will be taken out from your fat cell, so it's strained, and that's how you will slim down. So basically all the treatment here that we have for fat cell volume, there are a few. So the most common one that I found my patient love it a lot, that is this medication, which is known as Adipex and Duramine. So the active ingredient is the same. These are phentermine. So phentermine, there is a medication that will deal with your brain receptor. So basically it will subside your appetite and increase your metabolic rate. So when these two things, yeah, that come together, it can take out the fat cell volume, reduce it and shrink it. So that's why you can slim down. When you look at the scale, you reduce your weight, reduce your number on the measuring tape. So these are the good things when the fat cell volume reduce. So what is the difference between the Duramine and your Adipex? So Duramine is 30 mg of phentermine and Adipex is a 15 mg. So who should take which one? So it depends on the size of the patient. So big size patient, they will go for Duramine. Small size patient, they go for Adipex. Yeah. So side effects, a lot of people will ask this. Yes, this medication there's side effect because it deals with our brain receptor. So side effect will be low mood, your mood swing, you will have low appetite, which is good. Actually, this is the effect that we want. You don't feel like eating, and your insomnia is one of the things that kicks in, and sometimes your sex drive also reduce. You do not have the urge to have sex. So these are some of the common. Dry eye also one of the side effects as well. Dry eye, dry lips. Some of our patients experience this. So but my recommendation to my patient is to enjoy with they have to go through the side effect for next 2 weeks. So after 2 weeks, your brain receptor is starting to be adapted to this active ingredient, phentermine, and that's how you will slowly wean off from all these side effects. Yeah, but this medication also have to take with care. Is a list A medication. Only some of those recognized clinic that have these two medication. So to stop it, also have to with care as well. So cannot just stop abruptly. You have to stop it gradually. Let's say if you start with phentermine, Duramine, 30 mg, then after 3 months, you can start converting yourself to Adipex, 15 mg. Then slowly you taper down from this medication. Okay, so this is the first one, and it's the one of the cheapest one that we have. Yeah, but the result is good. Yeah, most of my patients can lose at least a few kilo. Yes, from this medication. The next one that we have is our liposlim program that we will give something like HCG. So it's a human chorionic gonadotropin hormone. So basically this hormone will use in very low dosage daily or injected like the insulin pen into your subcutaneous subcutaneous fat layer. So basically it helps to reduce your appetite as well, and also to increase your metabolic rate. So patient in this program, they have to follow a very strict dietary plan. So basically for them, they need to keep their diet per day at 500 to 1000 kilocalories. So it's not a lot. 500 is almost the same as a curry noodle. So for those who doing this program, they will get a list of the dietary plan that is suggested by Premier Clinic. So but surprisingly, the result for a HCG diet is rather high, around 5 kilo for 40 days program. So I have cases whereby the patient took 4 cycles, that means 40 times 460 days. So from 86 kilo can reduce to 65 kilo. So it's like 40 days for 5 kilo. So she have lost 20 kilo on this program itself. So the commitment is the main thing for this program, because you really need to have a strong mindset. Keep your diet at 500 to 1000 kilocalories per day. Yeah, so that's why most of my patients, when they mention about this thing, they say I can't commit so much, so they go for this Duramin Adipex. Yeah, so for Duramin Adipex, something that we can add on. Yeah, that will be some of the supplement is some extract from the plants that we have here as well. That is the Zacnoctil and Lycosino. So Zacnoctil basically is a fat burner. It can help to burn your visceral fat. So you'll be taken 30 minutes before every meal. Lycosino is another one that is a fat binder. So it can bind those fat that you have taken after your meal. So basically, in another way, it means that you reduce the absorption of fat cell, the fat that you have taken from your meal. So that's why this one is taken 30 minutes before meal, 30 minutes after meal, and 30 minutes before meal for Zacnoctil. So these two combined together with your Phentermine and Adipex give a very good result in weight reduction. And of course, we have something for detoxification that is Easy Pro 123. So it contains different kind of plant extract here. So you have cranberry, you have pineapple powder, passion fruit, yeah, you have soybean, yeah. So different kind of those food extract, and most importantly, they have some probiotic and prebiotic as well that can help in the normal flora of your intestine. For this one, depends on individual, but some of my patients will have frequent to the toilet after taking this. So it's 6 hours after you've taken a sachet. It's a sachet powder, so you pour into a cold water and you drink it. So 6 hours you will go to the toilet to poo. So usually I will advise my patient to drink it for lunchtime. Why? Because around 1 o'clock, 2 o'clock. So by the time you go to poo, it's around 7 to 8 o'clock. So you do not disturb your sleeping pattern. Because I myself have experience. I took it like 12 or 11 o'clock at night, and I have to wake up at 6 o'clock to poo or 7 o'clock to poo, which I do not love it. So that's why I switch it to the lunch for my patient. Just some suggestions so that you can have a nice good sleep at night. Yeah, so basically these are the things that we have here for reducing of your fat cell volume. And the cons of reducing the fat cell volume is rebound. So rebound is one of the problem for when you reduce your volume, but not the fat cell number, because the fat cell number is still there. There's a lot of fat cell. Once you withdraw from medication, when you get rid of your mindset, you eat a lot, you do not exercise, your fat cell is still there, readily to absorb the extra energy that you did not burn off. So that's why the rebound is always there for this category of medication, but somehow my patient do love it because they feel the satisfaction when they see the scale is like going down, the tip is like getting smaller, yeah, so they feel very happy, and I do agree with that as well. So it's another way that patient can learn of the food. So once my patient are on the different kind of this slimming program, they will understand the food more thoroughly. They know, oh, this thing costs how many kilocalories, I should stop this, I should stop this, because they have a better mindset, better understanding of their food and their nutrition as well. So I think that's all basically what we have here in Premier Clinic for the slimming program. So if you have any more problem, do not hesitate to call to our clinic, yeah, or maybe you can visit to our website to know more regarding all these slimming products, yeah, and another one, the slimming machines, yeah. So we are always here to help you to slim down, yeah. So please to call us, yeah. Bye.